can't go without talking about health care here. And I have heard different candidates advocate that, well, we'll just end the war in Iraq and we'll use that money and it'll help in part to pay for health care. But that would seem to me to be an unrealistic proposition, because you're not going to pull out of Iraq overnight. So how are we going to fund all of these wonderful ideas that we have for health care?
Mr. Carter.
Oh, this is an easy one. Health care, universal health care. The other party will call it socialized medicine. But every industrialized nation on the face of this earth has universal health care. We don't want universal health care. We don't want socialist medicine. They've put us in a position we don't have any choice. But let me tell you how to fund it. Forget about the Iraq War and all that. Take the premiums you're paying right now. Take the matching funds that your employer puts in. Take out the medical gouts, no offense, that's taking place, and the medications and the charges that we're paying. And all of a sudden, you've got universal health care already. You paid for it. You've been paying for it all along. You just have not been getting it. And let me simplify it. Because health care people, it goes off in all kinds of tangents. It's real simple. And this is what made my Republican buddy a little mad yesterday. All I want is what the congressmen and the senators have got that we're paying for, that they're voting against, that we can't have. Now, we're paying for those, and we're already paying for ours, but they're stopping us. The reason they're stopping us is because there's a gap, and that gap is money, and that money is going into the coffers of the medical profession. And it's billions and billions of dollars.
Mr. Overton.
I believe in universal health care, a single-payer system. I want to get rid of for-profit insurance companies that make decisions that only you and your doctor should make. We pay for that very simply. With universal health care, we do not need Medicaid or Medicare anymore, because those health benefits we paid for under universal health care, everybody will be covered, no loopholes. That puts an estimated $45 to $50 billion back into the health care budget. You repeal the 2% tax cut that Bush gave to the richest Americans, and that's another $40 billion a year, which brings us to close to $90 billion, which is the cost of universal health care for one single year. That's how you pay for it.
Paying for it. We're already paying for it, all of us. The average American family pays an extra $922 in their health care insurance payments every year to cover the uninsured. So it is costing us. And if we design a system where we cover those other people, we will bring the cost down. Now, are we going to cover them for free? No, you're going to have a means-adjusted fee for these people. So if they have a lot of money, they will pay a full fee. A lot of people would like to get rid of the insurance companies, but the truth is, it is an industry. And it is an industry that has a big profit, and it has a war chest. They will not allow a single-payer system, certainly not in the immediate future. If you design a system that covers everybody and allow it to evolve, then we may end up in a single-payer system. And countries have that. Not everybody, but many. There are some that have a single-payer system. However, we have to cover everybody, or it's going to cost us. And we have a $1.3 trillion health expenditure in this country every year, 15% of our gross national product. And if we bring some efficiencies to that, if we institute some electronic medical records, if we institute evidence-based medicine, if we institute some malpractice reform, we should be able to bring some cost savings to the system. Do I get 30 seconds to rebut what he said to me?
I think he attacked doctors in general, so I don't Sure. Well, we'll let everybody have you can do that. I'll let everybody go 30 more seconds.
On Dr. Bratton's website, she calls for businesses to mandate health care for their employees, which is not single-payer universal health care. And I just want to be clear on her position, whether she is for or against single-payer universal health care. And that's the question I had.
Okay.
I am not for a single-payer universal health care system at this time, because I don't think it is all realistic to think that we could institute one. And if we tried, and insurance companies didn't lobby and absolutely block it in Congress through their lobbyists, we would be taking an industry that has many, many thousands of employees and saying, okay, you're now without a job, you're going to have to go off your job, and you're going to have to go get another job with this new entity that we're forming, which could happen, but it's disruptive.
Okay. And Mr. Carter, you have a dog in this fight?
Confusion is always a dog in a fight. I'm a simple man, simple Southern, born, bred, and proud of it. Anytime somebody gets too complicated, they miss the issue. It's real simple. I don't want to repeat it, but I will. Universal health care. It's already paid for. You're already paying for it now. You're being denied it. You're being cheated out of it. If it wouldn't make any difference, 18,000 people a year would die from lack of health care. They are. The arrogance of the HMOs is almost intolerable. We got our insurance man walk in the office and says,
Yeah.